I'm Vera. I work at Hope Medical Center and I'm a speech and language therapist. I am here today to talk about feeding problems in young children and toddlers and infants. Feeding problems are estimated to occur in 25% of normally developing children and up to 35% of children with neurological impairments. A common definition of feeding problems or feeding impairments is the inability or refusal to eat certain foods. This requires early intervention because problems with feeding may lead to psychological, nutritional, and global developmental problems. Problems are very different in their nature. We can have children with food refusal, we can have children with oral motor problems that don't allow them to suck, swallow, or to chew. We can have children with behavioral problems during meal times, children that do what we call the rumination, or that have pica, that eat many different things that are non-food items. And so it's vital that the speech and language therapist helps the families to deal with these behaviors. It is quite common that in our speech and language therapy sessions, we have children who are able to swallow safely, but don't have the oral motor skills, or on the other hand, children that cannot swallow safely, but have the oral motor skills. So the role of the speech and language therapist is to assess exactly from the moment when the food is put in front of the child, what can the child do? Can they recognize the food? Can then they put it in their mouths safely in a safe fashion and chew on it, and then produce a safe swallowing moment so that they don't choke. On the other hand, we can also have children that have behavioral issues, for example, or sensory issues. For example, they like only a certain type of food, or they only eat a certain type of food. And on that case, the approach would be a little bit different, will be more behavioral management.